So what is MNTrac? A little history: tracking resources, alerts, and communications for better Minnesota. That's right on their front page. It's MNTrac.org is the website. I'm sure you have it all saved in your bookmarks, but MNTrac.org, pretty easy to get to. MNTrac's the system for tracking resources, alerts, and communications. Database-driven system, web application. So it's all based out of the cloud and intended as a statewide solution. So again, it's open to all of those coalition members that we talked about earlier, and some other ones that aren't included in coalitions. The system's been designed specifically to track bed and pharmaceutical resource availability. So what do you have within your facility, and how much do you have available at certain times? It supports that surge capacity needs and anything revolving around a mass casualty incident, as we'll get into a little bit later. But hospital bed diversion status, emergency event planning, emergency chatting. There's a couple chat features within the program. Alert notifications. You can send alerts, which sounds like some of us have already done within the room here. And information is aggregated from all those facilities and can be shared and kind of transported. Reports can be printed out and things like that. So plenty of useful information within the system. Here's some of the key features just to kind of expand a little bit on that. Live website with those day-to-day operations, emergency alerts and advisory notifications, hospital diversion status reporting, as we talked about, just some of that basic facility information too, like addresses, phone numbers, things like that. How do you get a hold of the hospital? Where's it at? What kind of offshoot clinics might they have? MCI assignments, of course, resource tracking. You can upload some other additional resources that you have outside of beds even. Emergency communications tools, like we talked about. There's a chat room, there's conference rooms in there, things like that, alerting. And then, of course, the report writing. If you have any standardized daily procedures that you need to print out a report on, you can easily do that in the system as well. So those are some of the key features of MNTrac, and it's really an easy system to use, as you guys know. Once you get in there and play around with it a little bit, I don't think there's going to be anything on this call that you're going to go, wow, I don't think I can do that. I think it's really, really self-explanatory in parts. So that's the nice thing about the system. It's just a matter of getting people to get in there, knowing what it does, and then inputting that user end information into there. So what does the system do in emergencies? The system allows for that like we talked about, that interfacility virtual communication back and forth, especially tracking of patients, bed capacity, and any pharmacy or other resource data. Information is aggregated from all those facilities and can be transported to other systems, like we talked about. Use it to improve communications, share that pertinent information from one agency to another. And then standard and ad hoc reports can be generated, like we talked about before. So the system is owned and administered and maintained by MDH. They purchased it, they ran with it since the start. And then the support agencies are those coalitions, which get their funding through ASPR. So MNTrac.org, there's a few features and stuff you can read on here, but over here on the left-hand side, this is where those regions are broken up. Hospitals and long-term care. If you're a hospital or long-term care facility, the contact for MNTrac is easily accessible there with a link. Some of the folks we talked about in the Southwest, it'll be John, probably first, then Kristen, then Ann. It's who you're going to want to talk to if you need additional permissions or have questions moving forward. And then down here, EMS agencies. There's also access there through this staffing list, and then local public health as well down in here. So plenty of options to get assistance into the system. So on the right hand side, you see your system login. You should have your username and password. You should drop into basically the home page, which should look something like this. Again, it's going to look different based on the agency, whether you're a hospital or EMS or emergency management. So I'm just using the emergency management one right now. So throughout kind of the training, we'll have to play around with kind of what you're looking at and stuff. But your homepage can be designed basically however you want. These blue ribboned boxes are called widgets, and they have plenty of different widget options here. As you can see, mine's a little messy right now, but over here on the right-hand side, you click widget preferences, and you can take a look and add or subtract any widgets you want. If it's a little too busy, you can take off the clock, you can take off current status, and it'll do that automatically. So you can see, cleans it up a little bit. So nothing overly complicated there, but just know that there's other widgets you can add if you'd like. Maybe then you click save, you'll see a little wheel going around, and then there we go. And so if you click on the blue ribbon, drag it around, you can actually manipulate this page however you want. So if you want some of the less important stuff towards the bottom, maybe a clock in the upper right, maybe all the bed capacities over in the same area. If your emergency manager, is the EOC activated, yes or no? There's an alert box. A lot of times when you come into the room, there might be a either statewide or regional alert, and that'll pop up and take up the whole screen a lot of the time. And then there'll just be a little button. You can read it, potentially take some action on it if there's a attachment or something, and then just acknowledge the alert, and then it'll just show up like this. There are no current alerts out there. MCI patient capacity, which is easily changed by just clicking update capacities. You have the capacity for 2 reds, 5 yellows, let's say, and 6 green. Then you just click save, and then it shows up. Again, it takes a little bit of time, but you can see, especially on the hospital side, how much these can change. And so it's really hard to keep it up to date, as I know you guys know, but it's something that just should be done every morning, especially more with the bed count, I would say, because we're not going to have an MCI incident all the time. So then you just can click easily reset, and then it'll just reset itself like that. So status overview, regional and statewide, bed information down here. You can update that easily by just clicking update all, and your bed count, available beds for assisted living, and we'll go through on the back side I only have 2 bed options as EM, and I think those are I put those in there as examples, but you might have quite a few more different options there as a hospital system or EMS agency. You can click 4 and easily change those, and then just associate a name, and the name is based on what agency you're from. So you can see here, it's a lot of the Southwest emergency managers, because that's the agency I'm with. So this isn't really applicable for emergency managers, but just as an example. And then you can just easily click save all, and it updates. Sticky note, you can type in MNTrac Training, 5/17/24. Yeah, so you can use that however you want, just a very simple little sticky note. Bed surge, same thing. You can update your bed surge numbers here. It again takes a little while. Assisted living, medical and surgical, again, you might have more options than that. And again, clock, you probably don't need that on there. Document hubs, you can upload documents. We'll go through that a little bit later. Emergency contacts, teletracking information we'll go over later. And then, yeah, so this is pretty much your home page. And again, you can maneuver it however you want. It should land you on this page. And if it doesn't, we can go through how to change your settings so it does land you on that page. So that's basically they call it the dashboard, homepage, whatever you want to call it. And it'll look a little bit differently again, depending on what agency you're with. So let's go through adding staff. That's an important piece. I heard that earlier from somebody. So I'll go up to your upper left-hand corner where your agency is. And you'll click on, so you'll have a drop-down menu here, agency summary. which again is that home page. Inventory goes more into the resource side of things. I don't think there's going to be anything that shows up on my end, but and then there's a sub menu under all of these. There's a gray sub menu that comes up that is underneath that first choice. So if you go to staff, so to add staff, you click on upper right hand corner here. It's always green. If you add a record or add a document or add something to it, it's always in green with a little plus arrow. So you just say add staff. You can walk through it here. And the only people that are able to add staff facility administrator. So if you're not a facility administrator, you might not have access to this at this point, and that's a John call. If you need access to that or need to add people and you're not able to, give John a call and he can maneuver that. Get your permissions correct anyway. So you add staff. I'm just going to add like my deputy EM, let's say. So Lyndon Warden. Title is EM Deputy Director. And I don't like to get involved in home addresses necessarily. I always put the work address in there, whatever facility he might be in, especially if you're a hospital of multiple locations. It's good to put the address of wherever you're at. I think it's 422 Fifth Avenue in Madison, Minnesota. Obviously, a lot of this is just self-explanatory as you walk through it. I'll make up a number here on his cell phone, 701. And then if they have a pager, you'd enter the pager number and then the provider here. Really important that you add the provider just for the system's sake. And then their email, which would be qpco.com. And then you can save, but then it goes into draft form. So if you're continuing to add, click save and continue because there's a few more options when you add staff. And you can see this red bar here that looks like it's kind of moving to the left. That means the system's kind of working itself. So then you have to assign them a username. And a lot of times it's like last name, then first initial. So like Warden L was Lyndon Warden. And if you have a certain email system for your agency that you use, some sort of standard, you could do that. Like let's say it's Lyndon dot. I mean, that's a good way to do it too. So whatever system you want to implement is fine. You can make up a password, but there are quite a few things to note here, quite a few requirements on the password. You do 1, 2, 3, 4, ABC. 2, 3, 4, ABC, capital D, exclamation point, let's say. BCD, 1, 2, 3, 4, exclamation point. And then you want to force password change on login so that when they get the email and sign up for the system, they're forced to change their own password. And it's not going to affect your administrative roles. You're still going to have access to their account if you're an administrator, so it's not going to take that away. Your primary agency, which would likely be whatever you see up here in the upper left, unless you're dealing with a few different ones, and then you'd select whatever agency you want to put there. Permissions group, and it goes from most advanced down to basically just read only. So if you want somebody as high as you, it'd be like facility user. And if you want somebody who can basically just read what's on MNTrac and not change anything or update anything, that would be down there. So a lot of people put basically facility user on there. That's a lot of what's going to be there. Current status active, they're going to be active, of course. And then when you have to go back through and say they leave or quit or something like that, you just come back into their name and click inactive and then put save. So their information isn't exactly deleted, but it's in there in case they move hospital systems or something like that. It's going to be easy for the other folks to add them in. So they're active. No access to reports, report users, report specialists. I'd always make sure they have at least access to the reports. Facility user again. And there's just some information basically like this that you can be facility user mostly, I think, for everybody on this call. And then command center settings. So we'll get into the command center in a little bit here, but save and continue. Oh, passwords don't match. So to let you know if your passwords don't match, what we say A, B, C, D, 1, 2, 3, 4. Capital I, capital A, B, C, D, 1, 2, 3, 4, capital I, capital. Okay, let's try that again. This will change all other security settings for this user. So the system will kind of talk to you a little bit if there's an issue or they think something important to say. So it's saving here. You can see adding a user takes some time. So I would always make sure as it's loading here that you have at least 3 deep on your admin side. And sometimes that gets a little, especially if the other folks don't use it that often. Got to make sure that they don't go in there and change anything that you don't want them to. But if something's going on and you're not in the hospital, you're on vacation, something like that, it's important to have other folks that have full access to the system on behalf of your agency. So keep that in mind. If you don't, go take a look at your settings and make sure there's somebody else possibly that can get in there. And so this gets into, and you can see on the top, we're moving through the gray boxes here. So we're on box 3 of 4. You can change. This is where you can add the landing page. So it would usually be the My Agency landing page. Alert settings for the user. This little box is email. The next box over is like a cell phone alert. So it'll go to the cell phone that you inputted on the previous screen, the demographic screen, and then any pager information. And again, you just hover your mouse over those and you can see those too. So it's not, and then it lets me know I didn't include a pager. So there's no sense in doing that. So there's 4 alerts I would say to make sure every user has. One is the MDH alerts down here midway. Make sure they get alerts to any statewide updates. And then regional advisories and alerts, I would also do. If MNTrac sends out an alert on here, it's usually something that people should know about. So again, it's just kind of duplicating the messages for your agency. So it's not just going to you, it's going to several different users, and then you can, discuss or whatever action you want to take. And sometimes the alerts don't necessarily need any action. So, and then any bed capacity alerts, save and continue again, like we've been doing. This is where you can set up any diversion settings. And this is very, very hospital centric. So this is where you can set up, again, email, phone. There's quite a few different options here. These are just examples, ABC General Hospital. And your hospital or other hospitals would be listed here. And then that goes in to a little bit more advanced training that we're going to do later. So don't get too hung up on that. And then there's other things in here that I won't spend too much time on, specialty settings. Again, like acute care, tiering, different things like that you can set up within this user. And then you can check any notifications that the user received and which ones they've acknowledged themselves. And there's no data here, obviously, because we're creating this profile now. But in the future, you can kind of see what they've gotten and what they've clicked and acknowledged. So you can have kind of a timestamp of when they access the system. Then command center settings. You can, not many options here, but you can add those. Room member invitation. We'll go over how to create a room in a little bit here, but then they'll get notified when that happens. So that's basically it. You can add trainings and stuff in here depending on how much you're in the system. You can really, there's a lot more in here than, as you can see, you can really go down rabbit holes on some of this. So you can add training to each person. That about does it for the user. And like we said, we've been saving and continuing all the way through the process. So that user should now be in the system underneath your agency. Agency setup. Let's see here. So if you go into agency setup, so it's the next tab down underneath staff, make sure some of this information is correct as well. Something to do if you haven't been in here in a little while. Your agency name, associated numbers that are going to be kind of based on either your hospital or different things like that. Patient tracking type, categories. A logo, if you want to upload your logo, you can easily do that. Then again, the gray bar across the top, locations, you have helipad. What are the lat and long of your hospital? What's your business location? I would definitely make sure to fill this out. Your where is the actual location of your hospital? Where's the shipping address? Pharmacy loading dock, if you have one of those separate from just the regular loading dock, I would just put that in there. Any alternate care sites you might have, and then click save in the middle on the bottom down there. I won't walk you guys through this. I mean, that's pretty self-explanatory again, but. And then also contact numbers is another thing on the top bar I wanted to. What is the contact number for your agency? So let's say 7129737, which is my cell phone. Make it public, doesn't matter to me. Should be saved. Sometimes it's kind of hard to see if things save in here. There we go. Some of your MCI information for red, yellow, green. We know all that kind of stuff. And some of it might change, and some of it might stay fairly stagnant. So bed specialty, like when we go through this, it's very hospital specific, so I won't spend too much time on it, but some of your time limits for your diversion statuses, it goes through bed, and especially the specialty tab here, really depends on the hospital. And I can't see a ton right here, which is why we're trying to build out that demo website on MNTrac. So I apologize for some of the lack of visuals here for you guys, but. And then here's where you can input your bed data for the hospital. And you can see there's quite a few different options here, depending on your needs. So. Then it gets into more specific stuff like alternative names and stuff like that. But make sure to fill some of that information out if you haven't. It's really easy to do in 10 minutes, and it'll just be a lot quicker for folks who are responding to emergencies to get a hold of you, and you have the right contact information in there and things like that. So pretty easy to use. And if you have another agency, like say you're part of EM, but then both hospital, the Madison Hospital and the Dawson Hospital, want me to be within MNTrac within theirs, you'd have a different option here, and then you'd click switch agency, and you'd click on other agencies that might be available. Command center, over that quick. Basically, you can create a room, which is it's almost like creating a command center. And there's one in here already for Southwest Comex that we've talked. I think that happened in early May. Yeah, May 2nd. It'll show you the users, and then if it's active or not. And this one is still active at least through the 2nd of June. You just click on that. And this will populate with whatever rooms you're in, and you can create a room. Edit this, you can create the name, the description of what's going on. So you could say major incident at, the Madison Fairgrounds, the incident is fairground explosion. You put emergency on there. Again, fairly self-explanatory. I would always keep it probably, if it's big enough to get into MNTrac, I would put it as a regional incident myself. Sometimes it might be a county level incident, but if you're going to create a room, I mean, it's probably either going to be regional or statewide. And that'll affect accesses of different things on the backside and start date, and then you can save it. And then, so here's the room itself. Here's kind of what it looks like. It shows you the different users that might be in there. Resource and documents you can add. And this acts kind of like your home screen. You can kind of switch these things around. Again, you can add more. There's a settings one here. You can change font sizes, text color, things like that. There's a bulletin board for any announcements or something. Again, green arrow means add. You can add something like test in the bulletin, add bulletin, and then it's right there. So if you have updates on the incident, you can easily put those within the bulletin board over here. And then anybody on the system that's within this room that you've identified can see kind of what the latest update is. So you could also add, like, let's just say new press release from a hospital available. So we'd add it, and then you could hit it twice. It's easy to delete them too. The little red trash can here, just delete. And then you can click reason, because on the backside, you can generate reports on all of this stuff. So when a big incident happens and you're going in here and you create a room and you do all this stuff, and let's say you get your whole command staff on here and it's really the thing you're using, you can print out a report on the backside that identifies all this stuff, has everything timestamped. So if you delete something, you can just say the reason was accidental duplication, then delete. But that'll pop up on the report side. So it's important. The system has quite a few different options, but then you can add the press release in here. Choose the file, upload it, press release, and then add resource document there. So, and you can add whatever you want here. Again, cloud-based system with unlimited, as far as I know, unlimited storage. I'm sure there's some number somewhere that can't get past. But so user, it says I'm in here, Blaine Johnson, Southwest EM. It has the agency right there. Any room notes like hospital command center open from 8 a.m. to 6 p.m. And you just put update, and it basically acts like that sticky note thing. And then there's an ongoing chat. Users within the chat room. These are kind of who has access there, and you can control that. Running up on time here, but there's some more options here that you can add resource history, and then you can see who's accessed it as well. So patient tracking, there's a privacy statement. You just hit agree. So that's this one on the top. There's a Southwest test. So you can, again, create an incident. So you'd go in here and create an incident. Fairgrounds explosion. And you can add users. And so it'd show up like this. And then this is what that patient tracking dashboard looks like. So a lot of the stuff across the top, availability status, patient tracking, command center, comes on and it looks like this. So you have rooms that look very similar, so don't get too confused between them. It's always highlighted right here, whatever room you're in or whatever tab you're using. And you can click add other agencies that have access to this patient tracking. That's how you would share that information. Incident timer has not been started because we didn't put a date on it or a time start. Any triage numbers, going to whatever location they're at. And then here's where the patient data would be inputted here. Patient's J sample tracking en route. So this is where you can edit those patients. Perhaps you have a triage number, triage status. This is where you can add those lovely colors we always work with, medical record. However much information, sometimes you don't need much. And sometimes it's better to just put first name, last name, maybe age. You can add photos or different things like that. But then kind of that initial status. And then you save the patient. And that's where it shows up. And you can, like I said, there's sub menus to sub menus as we get down and more detailed into here. And then here kind of shows the tracking history, where they've been, what services they're being, transported on, any belongings they might have, interviews that the hospital's done or anything like that. So again, it just gets into a lot of that stuff. And there's a search patients tab here as well. And a little bit of a history on that patient. So and it should automatically populate like number of patients here from patients tab. Once I didn't connect that, you can change it manually here too. Again, very easy to manipulate some of this stuff to your own needs. You can add services and different things like that. Search patients history overview. So that's basically the patient tracking. And then the document hub, I'll just touch on real quick before the end here. MNTrac resources, there's pre-populated resources in here based on the state and then region. So a lot of this is inputted by the state. That's kind of an overview of the whole system, and appreciate you guys jumping on, and hopefully you learned something or at least got a good refresher on some of this stuff. So